All right, we'll go ahead and get started. Hello, everyone, and thank you for joining us. The Southeast Mental Health Technology Transfer Center would like to welcome you to today's webinar event, Eliminating Mental Health Stigma for Boys and Men of Color. My name is Emily Moore, and I will be moderating today's event. And joining me in introducing our speaker is the director of the Southeast MHTTC, Dr. Benjamin Druss. Before we get started, a few words about our center. Please note that the work of our center is supported by a grant from the Substance Abuse and Mental Health Services Administration, or SAMHSA. And also please note that the work of our center and that of the larger MHTTC network uses affirming, respectful, and recovery-oriented language in all of our activities. The Southeast Mental Health Technology Transfer Center is proud to serve the 8 states in HHS Region 4. Our expertise in public health programs, systems, research, and evaluation provides a unique lens through which we can address mental health priorities. We encourage you to visit the Southeast MHTTC website, mhttcnetwork.org/southeast, to learn more about our center and upcoming events. A few important notes before today's webinar. This event is being recorded and will be made available on our website for on-demand viewing in a few days. We encourage you to share your comments and questions throughout the presentation using the chat feature. Please remember to select Chat with all attendees if you would like to share your thoughts with everyone. We have allotted time at the end of our presentation for questions and answers. Please submit your question using the Q&A feature at the bottom of your screen. And finally, for those participants who are interested, a certificate of attendance is available for download after completion of our evaluation surveys. I will go ahead and turn it over to Dr. Druss so that he can introduce today's speaker.
Thanks so much, Emily. It's my pleasure to introduce Lorenzo Lewis to you. He is a social entrepreneur, mental health expert and advocate, motivational speaker, author, adjunct professor, coach, and community leader. He's the founder of the Confess Project, an organization that trains barbers to become mental health advocates. Through his work, Lorenzo and the members of the Confess Project are teaching the world that mental health is not only a personal issue, it is a community issue. To date, the Confess Project has reached over 30,000 individuals in 13 cities across the country, including Louisville, Kentucky, Jackson, Mississippi, Indianapolis, Indiana, and more. In addition to his work on the Confess Project, Lorenzo worked as a program eligibility specialist for the Arkansas Department of Human Services and as a youth care worker at the Alexander Juvenile Detention Center in Arkansas. He's also delivered talks at numerous venues, including barbershops, universities, and TEDx events. So with that, we're just so happy to have you here, and I'm really excited about this talk. Thank you, Lorenzo.
Yes, thank you so much, Dr. Druss, and thank you to everyone here that's a part of Emory University and those who come near and far of the network. I'm going to go ahead and share my screen. I'm really excited for today and this opportunity to not only serve, but again, to talk about something that's very important to me personally. Building a culture of mental health for boys and men of color. And often I like to speak more about African-American men and boys simply because of my own journey. And I'll tell you why. So I was born to an incarcerated mother. When I was, my mother was incarcerated for a very short stint in Newark, New Jersey. And I remember as a kid being told this story, and I remember it sounding very confusing. It often reminded me of a very great sense of embarrassment to know that my life began in a prison. And where that story and where that journey really began to take me. It really took me into some very complicated life experiences One of them was that I went into a behavioral health treatment center at the age of 10. I never forget going into that treatment center and how things really changed for me. I never forget being away from home for the first time and, being confused, feeling lost, and feeling hopeless, to be very quite frank. I remember it really shattered my view of childhood in a lot of ways, being in a facility with really no one that I really knew. But I knew that I was a very unique kid. I knew that I brought unique challenges into my life. And it often made me think about my mother was incarcerated herself. Well, I want to transition life a little bit ahead of time. And at the age of 17, I found myself in a very peculiar situation, very similar to my situation when I was 10. I found myself incarcerated for a very serious crime. And I was grateful in that moment what life began to despair me and give me another way of looking at life because of being in that detention facility at the age of 17. I had threw it all away. I had often had indulged in my life of being depressed and being a part of gangs and having low confidence, lack of identity. It led me to some very tremendous behaviors that led me down a very risky journey. And I share all that to say, because as I open up and I talk about the great work that we've been able to accomplish, I like to always tell my story. As a storyteller, as a craft that I do, I often like to connect people. I truthfully believe that stories is one of the greatest tools that we can use in connecting one another. And, that's a part of my journey and how I got here. So before really talking about all the awesome things that we're going to talk about today and how there's an amazing model that's being used across 47 cities now in 27 states and reaching 1.4 million people, I really wanted to just tell a little bit about my journey. So building a culture of mental health is we'll be talking about today. I'm really excited for this opportunity. I do wish to leave some times toward the end for Q&A. Please don't be shy. Feel free to, I believe, type your question in the chat. I have some assistance toward the end of achieving the best way I can to answer your questions. So a little bit about myself, as I've talked a little bit about my journey, is I am a serial entrepreneur, social entrepreneur rather, and founder of the Confess Project of America, a best-selling author. I've written multiple books, and nevertheless, I do exactly this. I get to travel the country and tell not only my journey, but tell about this great model that we've been able to create that is really changing lives in a community setting inside of Black barbershops in America. Now also reaching salons and a little bit of more greater detail about our reach and impact. We've been featured in Oprah Magazine and the Kelly Clarkson Show and appeared on CNN several times, ABC News to say the least, about how training barbers to be mental health advocates has now become a movement and an early stage intervention that's really now tackling the challenges of mental health access for Black and minority communities. Nevertheless, also creating a safe space of destigmatizing mental health. I had the privilege of presenting with Dr. Drews at Emory University, and I want to thank you again for having the courage and the wherewithal of bringing me back. I maybe not say courage was the right word, but say having the determination rather of bringing me to continue to tell a little bit more about what the Confess Project of America does. We've recently located our headquarters to the city of Atlanta. And so we're now centered in the city of Atlanta, but we have affiliates across multiple cities in America. And so I just want to thank you all again. And this is a little bit of more of the background of who we are and what we've been able to, some of the things that I'll be able to continue to share about what we've been able to accomplish. And so I really wanted to, dive in and really talk about, the violence within Black men. When I began this journey of wanting to go inside of barbershops, it often made me remember when I was involved with street gangs as a young person. And I remember the violence that I not only witnessed, but the violence that I was a part of as well, and gun violence in particular. And we think about the amount of homicides and the different things that are attached to gun violence and the trauma that comes from that, it really leaves African American men in a very peculiar situation in regards of their life outcomes and their lifespan. And so that's what really gave me the courage to begin this work, was really thinking about my journey, also thinking about substance abuse. My mother and father having substance abuse challenges, being incarcerated, both of them, violence, gang activity. All of these were sentiments of my journey and what led me to want to go into this work, community intervention work, and mental health, particularly in advocacy, and working in Black barbershops and salons across America now. And a little really quick story, what it really encouraged me to go inside of barbershops and salons, to be honest, was my aunt's beauty salon as a kid. And I never forget going there as a small kid, about 5 years old, and my small feet dangling from the chair there. I found my first mentor by the name of a guy named Sylvester. And Sylvester was a very unique individual. I looked at him like a father figure. He was someone that I could trust. And he worked inside of my aunt's salon. She had about 5 stations there. And I went there every day as a kid. And that's where I really began to connect in that space. And it really reminded me a lot of what we're doing now and how we're building that same mentorship and trust and that model that exists now, that I'm going to be able to talk more about that model and how it exists and how it plays such a huge impact on the well-being and lifespan of our community members that we're serving today. But I want to be very clear is that, when you think about African-American men and racism and mental health, we have to think about the systemically oppressed systems that are in place and how toxic masculinity is at the epicenter of the challenges that Black men face in regards to getting mental health care. I can tell you from a personal experience, as I sit around and I work with, thousands of men. We've trained over 1,700 Black men and Black women, stylists, barbers, to be mental health advocates. And the one thing that we recognized, and even in our research partnership that we have with Harvard University, is that with masculinity and the three, what we call the 3 Ps, the provider, being the protector, and being the priest, being the person of reverence and importance, always halts these subgroup of people in how they live their daily life, and how this also impacts their mental health and their well-being. And so it's just a very, very huge component. I think we want to be very clear that we know that racism in our country is nothing new to anyone, no one. And it's a prolonged challenge, but in the regards of, cultural competency and connection, and validation rather to care is something that we always having to think about and create strategies around. And that's why this organization and its programs exist inside of barbershops, is to create that safe space. And I'm going to get a little bit more into the model. I know a lot of you all are wondering, like, well, what do we do and how does this look? And so those things are coming along here in the next few slides. And so I just wanted to, touch on a few areas in which we know, violence and racism and how mental health impacts the lifespan and well-being of young Black men and women in America today. And it ultimately affects all of our communities, right? It ultimately impacts public safety, our economy, and just a very greater range of community challenges. But more in particular, I'm speaking about this subgroup today. And I can personally say, someone who experienced, racism in school, someone who was handled and mishandled by police officers as a young person, what that did with my trust with law enforcement, and how I now can imagine those who are still, living in poverty, and how that can conflict with the way that they build trust, the way that they view life. It could very well be challenging. And I can remember, at the age of 10 years old, being put at gunpoint by police officers, me and my cousins, because they thought that we were victims of we were connected to a store robbery. And I never forget that. And I'll never forget how that shaped and changed my life with authority and with officials. And so just thinking of that of myself, I've done a lot of recovery and healing through my journey, but nevertheless, I can only imagine what it continues to do for Black men who are living in communities with lack of access, lack of opportunity, and but also lack of recovery and healing. Because I know I've done a lot of that to get to a place where I am today, to be able to talk to you, even in a place of hope and belief that we will move further. So, again, none of these things are truly new, but as we know, what can our communities do? If you're asking yourself right now, what are some things that we can do to impact racial equity in communities, Black communities particularly? We think about healthcare, we think about raising awareness, standing up to racism, being educated about it, seeing something and saying something. And as we know, one of the top ones is funding for mental health organizations. Really kudos to SAMHSA and their support today of how, just getting the word out, right? Being able to invest into people and to webinars as such. These are so important to continue to get the word out, but also bring qualified and quality training and content to people. And I think just being able to share and hear from those with different life experiences really can help impact things as well. So these are just a few things that we can do, and that I think can help enhance the way that we combat our systems and our oppressive systems that have marginalized African Americans, particularly men, boys and their families, to achieving the greater well-being in their lives. So I talked a little bit about what we do and how we do it. We are a community-based early stage prevention model that focuses on training barbers, particularly African American men, to be mental health advocates. As of recent, we have started to train stylists to do the same. We are actually in partnership with the Department of Behavioral Health and Developmental Disabilities here in the city of Atlanta, working with DBHDD. We're also in a beginning partnership working with DFACS and Department of Family and Children Services as well. And we're going to continue to model our work in the city of Atlanta to one day this being a global opportunity. Although we have scaled to 47 cities, we are looking to do more scaling to predominantly to more cities that have a vast amount of African Americans, and hopefully in the future starting to reach more minorities. So how does this training look in real time? It focuses on 4 key areas that has been measured and worked with Harvard University in an early stage research study that we did that focuses on active listening as one of the cornerstones of this, validation as another cornerstone of the training, positive communication as our third one, and then lastly, stigma reduction. But also something we've added to our training when we're training these barbers is how to access 988, how to connect with mental health providers in the community. And so that's something that we are now starting to really build in our model. Is one of our first clinics, and how do we offer therapy? So we're supported by the Arthur Blank Family Foundation. And one of the things that we were able to, a part of a convening and retreat, was that we come up now with a promise statement about how we promise to be the resource for boys, men, and their families, particularly in underserved communities. And so that's something that someone as myself who's underwent therapy and recovery from major depression and PTSD, knowing that it's so important to have providers that are culturally competent, those who understand the impacts of racism, those who understand the daily life challenges, are those who can give those that care. But something that we've also recognized is that in our Harvard research is that 32 of the barbers, majority were able to be recognized as mental health advocates, suicide prevention, and interpersonal violence gatekeepers. And so that's why we talked a little bit more in the front about violence and mental health, because these barbers are also in a very unique position to stop crime in the barbershop. And we have testimonials of barbers mitigating crime, even to domestic violence was seen in the study. If you want to read more and learn more about this publication, please visit the Confess Project of America.org, and you'll see the Harvard research study is pretty lengthy. And so please go out there to review that that study that has been done with Harvard. These interviews took place between September and December 2020 and consisted of open-ended questions that explored the barbers' experiences and perspectives regarding mental health and community services. The researchers' goal was to identify new methods to reduce traumatic injury and death among Black male youth while sharing the work of barber gatekeepers. And one very unique thing that we also recognized, and this was actually displayed in Oprah's magazine, is that we had a barber that we've trained that were in our organization, and roughly weeks after our training had a client to sit in his chair and stated that he didn't want to live any longer and that he wanted to die by taking his life by suicide. And that barber, having that training and being able to connect with a local therapist, was able to get that person the help that they deserve to live a longer and a more fruitful life. But on the other hand, we've had a very similar situation that happened in the city of Philadelphia, in which someone was inside of a barbershop and stated that they were going to walk in front of a moving train after they walked out of the barbershop. The barbers there, they panicked. They didn't have a clue on how to help them. And this was a prior group that we hadn't worked with prior to this. And so what we recognize is that the impact of our training has really helped to increase the lifespan and mobility of individuals who have come in contact with the barbers who had this training. Something else that we provide is that we provide focus groups bi-weekly. They go to what we call barber power calls and are able to support, our team is able to support them through their journey of being a mental health advocate. And so we're now also in partnership with Georgia State University, and we're continuing our research that we've started with Harvard University through the Department of Behavioral Health and Developmental Disabilities, a grant that we have that's able to continue to see that this can be an evidence-based model that can continue to grow and scale over time. And so we're continuing to invest into quality research and tools that will allow this to become a phenomenon in the long term. And just to be honest, the research confirmed that Black barbers play an essential role in communities as change agents, and that they can create lasting racial change. They can help community members build trust with one another and bridge the gap in Black communities between unmet mental health needs and mental health care. That really means a lot to me, because when the idea of this organization was in my head 6 years ago, I never would have imagined that we truly could be the change. Although I knew there was a possibility, I knew that there was a long shot to figure out how to really make it work. And as you all can imagine, with a lot of trial and error, we have went through quite a few things, tips, and tricks on how to continue to make this a better opportunity for the people that we serve. So again, I spoke a little bit about the Confess Project of Atlanta is opening up a mental health clinic to further support those reach through the training and offer clinical support as needed. Would love to connect with any providers, anyone that's working in the clinical space. We have a team of folks that have come from a range of different professional backgrounds in therapy and public health, but we're also open to learning and doing more in this space as we develop this first of its kind clinic attached to such a very prolific barbershop movement that has made impact and change in the lives of over 1 million people across the United States. And come here to the city of Atlanta is a great opportunity that we're looking to be a part of, and hopefully to continue this partnership with working with Emory University and working with Dr. Drews and his team, and anything that we can continue to elevate, as we know that this is a very important, critical, unmet need, but also something that we believe will be better in due time. So just to explain a little bit more about In the Weeds, I can only imagine a lot of you all are probably wondering, how's this structured? What does this look like? We have our national organization, the Confess Project of America, that is now located in the city of Atlanta. We started in Little Rock, Arkansas years ago, and we've evolved since then. And so now we have the Confess Project of Metro Atlanta, the Confess Project of the Bay Area. We do quite a bit of work in California. And now, as I've stated, we're looking to train more stylists, nail techs, and women, particularly to be mental health advocates. And so that's a new area that we're looking to launch actually later this month, starting to pilot that model more and really wanting to support more women and children is a part of the work that we look to do within the next years to come. So I'm really looking forward to that. And I can take any help and advice that you guys may have for us as we began to cross this new bridge of reaching more diverse group of people and populations. So, and I told the team here before we got started, I wanted to, I like to believe that I'm not a born speaker, so I like to, my storytelling is a good part of what I do, but also talking about a lot of the work that we do and the benefits of it. And, but I wanted to leave some time and space for those who may have had any questions, any feedback. Something that I think I may not have mentioned early in our call about the work that we do, and I think it may already be self-explanatory, is that, the way that we do our recruitment and retention is truthfully through word of mouth and through trust-based relationships. So we partner with corporations like Gillette that make the shavers for men. We partner with Andis who make clippers for barbers. So that is one of our key ways how we've been able to grow over the last few years of developing these corporate partnerships. In the past, we worked with Google and companies like Snapchat that has allowed us to connect with more barbers digitally. And so we've done, I think, a terrific job of the momentum and even with PR support of kind of keeping the fire going. And so now we like to believe that we want to take a step further and really further our work and going to becoming a one-stop shop for care for Black men, women, and children. And by using that model, again, starting in Atlanta and testing that over time to developing a more robust national model that we've already started to do in communities and making it more robust over time. But just wanted to kind of share that. I always know that's a question that I'm asked often about engagement and what does it look like, and how we've been able to be successful in keeping their attention for so long and keeping them to coming back. Right now, we're working on a campaign. It's a media campaign with an organization, but We've gathered about 144 barbershops, I think across maybe 10 states. So that's just the kind of reach that we have and the work that we've been able to do. We train 1,700 barbers. We also work with barber colleges, schools, academies. That's something that we've been able to invest a lot of time into. And yeah, we kind of do everything grooming. So everything grooming and beauty, we're a part of it. We attend major expos and industry events. And we do the work of mental health and public health in this setting. And so really excited again to connect with you all and wanted to open the floor up. If you want to connect more with me, feel free to visit LorenzoPLewis.com. If you want to learn more about the Confess Project of America, how do I get barbers trained? How do I connect as a therapist? How do you get listed as a provider? Please visit the confessprojectofamerica.org. Drop a note. There's also forms that you can fill out and people, can get in contact with you. Any partnerships the same way. So all of those can be floated through that website particularly and connected with me if there's any needs around training or the work that I do for the organization is being a spokesperson. I am the founder of the organization, but I've been grateful to transition new leadership with the board that's now taking the organization by storm. I'm really excited. And so again, yeah, thank you all so much for this opportunity. And I wanted to open the floor up. If there's any questions, any feedback, we'd love to hear from you guys. Thank you so much.
All right, thanks so much, Lorenzo. I'm going to go ahead and read the first question that we have in the Q&A feature. And that is, does this initiative operate in Baltimore, Maryland?
No, we do not. Believe it or not, I would love to connect with someone in Baltimore. We know that this could be really needed in Baltimore. And interestingly enough, I just got into a new fellowship, which I believe will help me. There's a young lady there from Baltimore that does some work that I'm looking to connect with. But no, I can take any recommendations. But no, it does not exist in Baltimore as of yet. But we are in cities like New York, Philadelphia, Connecticut, but we have not, in Boston, but have not gotten to DC, Baltimore, Virginia, and not as of yet. So.
All right, our next question in the Q&A feature, how do you support the mental health of the barbers? Is this the purpose of the barber team calls you discussed?
Can you repeat that one more time? I'm so sorry.
Sure. How do you support the mental health of the barbers? Is this the purpose of the barber team calls you discussed?
Yes, correct. Yeah, so that's how we support them. Believe it or not, there's quite a bit of, and this has even come up in our research that we're doing now with Georgia State, is that we're looking to even do, how do we support the actual barbers in their mental health, providing them therapy so that they can be able to be advocates. So that is something that we're looking to maybe create a sub initiative and or sub programming around that. But right now it mostly supports them and how they support their clients. That is the current focus. But there is talks about how we will create an angle of whether some type of form of way of ensuring that the barber's mental health is intact so that they can be who they are. As we've recorded and measured that about 20 to 25 people see one barber a week. That's about 100 people a month. That's new and existing clients. So really good question. That's something that we're looking to evaluate and how we can support because a lot of these guys or women are saying that they're really worn out, that they need help and that they're overwhelmed. And so we are looking for ways to support them. So really good question. Thank you.
Thanks so much. Our next question, we have a few people who are interested in contacting you to get more information and are interested in having this presented to other folks such as county social workers. How can folks get in contact with you to ask about further presentations to different populations?
Yeah, so I'm putting the websites in the chat again, just for easy accessibility purposes. If there's any So it's kind of two places to go. If you're looking to connect with getting barbers into a city, connecting barber, we do virtual trainings as well. We partner with a lot of different foundations, family foundations, governments. We work with the Department of Mental Health in Mississippi. We've been brought to where George Floyd was killed. We were brought in by the Department of Health there in Minneapolis. So we, on that end of the work, there's quite a bit of working with providers, working with health systems, foundations, governments, corporations, to bring us in to do training. So that happens quite a bit. There's a gentleman named Darnell Rice. If you can reach out to the Confess Project of America.org, they can help to support that. If there's any trainings or speaking lectures that needs to be done, working with populations, professionals, I'm your person for that. I've listed my website as well, LorenzoPLewis.com. Feel free to please reach out. We can definitely see how we can fit that need, as we do quite a bit of, I do quite a bit of these type of formats as well as in person. I'll be also speaking next month at the National Association of Medicaid Directors. So speaking over 56 Medicaid directors in DC about how we can bring Medicaid into our work more closely, being that we work with so many people that are beneficiaries of those who don't understand the process of Medicaid and how that's a huge part of linkage to care and access. So those are just examples of even more in-depth areas of partnerships that we are developing, and that I'm looking to transition our message into those bodies of people. So hopefully that kind of answered that. Thank you so much.
Thank you. Our next question, how does the Confess Project frame the boundaries of what barbers can do with regards to mental health versus when they should refer out for formal treatment?
Yes. So if I'm hearing that question right, could you repeat that one more time? I just want to make sure that I'm head up spot on. I'm sorry.
Sure. How does the Confess Project frame the boundaries of what trained barbers can do in regards to mental health versus when they should refer folks out for formal treatment?
Absolutely. Really good question. And that's something that's, so what we do on the front end of our work is that we do a pre-assessment to one, make sure that these barbers are, in a place they're emotionally fit to even carry it out. It's really, I like to call it a very hygienic training. It's very early stage. So it's more, listening, communication, validation, recognizing someone going through withdrawal, maybe life changes. I mean, they're kind of visiting with the same person for weeks at a time, right? They're cutting their hair. What we like to always say is that we're only showing them a way of how they can better communicate and execute in the times of a challenge. Saying that to say, if they recognize someone is in danger, in a life crisis, want to harm themselves, harm others, we're also ensuring that they know, that 911 is as accessibility, or 988 rather, if someone is in a crisis and want to die by suicide. But also in addition to that is knowing that they can reach out to the Confess Project of America, as we have people that are able to help support them with getting to therapy. Sometimes it's a matter of that person may not be comfortable because they've never done it before, but they know someone needs some help and they don't want someone to not be around or whatever the case may be. So that we often have gotten quite a bit of feedback for that, but we also work with local providers. So we work with providers in communities where in which a lot of times they go out and visit our barbershops that we work with. And we've also, in the training, we make it really clear. We give them materials, numbers, pamphlets, I mean, you name it. They have all the tools needed to say, hey, if this person is exhibiting, X and Y, and this is out of your scope of work, and please, refrain to using this. Please do not say this. And this is, how we keep things afloat. But they're also really, I think they're really hammered in to know that they're advocates, they're gatekeepers. And it kind of goes back to the Harvard research study. They are suicide prevention and mental health gatekeepers, and helping prevent the challenges that can lead to. So there's often been times where we've even seen cases where someone a situation could have led to gun violence. And the barber was able to stop it due to bringing people together to talk about the challenge before it got bad. Or even a situation where both clients went to the same person and they didn't like each other and they were able to mitigate that challenge. Or, you know, someone's child goes to the same barber, or another person there knows them. And so it kind of, we create this thing of what I call village care, right? You know, believe it or not, barbershops and salons in our community, you see everyone from the principal to the homeless neighbors to children to grandmothers, everybody of every walk of life, every socioeconomic background you can imagine is in this space at some point in a week, or in a couple of weeks. So, you know, and so it's nothing to see a principal, you know, there, and when a barber cuts the principal hair and also cuts a young man hair, or a young lady is connected to a father. And so that's why it's so important now that we're broadening our scope to supporting families, to ensure that those people have the tools and have the resources. So we're just the middle person between community and, you know, providers, government, researchers. Well, I like to say we're the middle person, the middleman between all of this, to making things happen. I think that's why we were able to get Harvard to come to the table and other researchers, because I understand the value in this. Our team understands the value in this. And so I think that's the role that we play, and how our barbers see them playing a role, as they are just gatekeepers and those who can help to refer.
Thank you. Our next question, what are some of the things or resources that you were offered as a youth that did not help or that made you feel inferior, so that these sorts of things can be avoided in the future?
You know, to be honest, that's a really good question. You know, I think some things that I know that definitely didn't help, and I wouldn't say, you know, it was some challenges, was, you know, my family was not really informed about, you know, mental health and ACEs and trauma, and how this can impact someone's lifespan and their health and their well-being. And so I think like the work that I'm doing now really helps to increase families' efficacy and literacy of mental health tremendously. I think that can change a myriad of things. But I like to say that, you know, I think we're doing a great part of that through education. And so I believe that for me, if that had have been something, you know, in the early 90s, you know, that had have been more prevalent in Black families, that would have been maybe a tad bit easier, right? Because recognizing that some of the behaviors and things that I showed was coming off more as anger and rage, and it was actually depression, it was anxiety, and it was it was connected to PTSD and the different things that I went through, and it was the reason I got incarcerated. And so it was more prevention that wasn't actually included in my upbringing, I believe. And so I think that's now why it's so important that I'm showing up for my younger self through helping the community in a way I think that can drastically change their outcomes. So hopefully that kind of gives some context.
Thanks. Our next question, you mentioned having partnerships with Gillette and with certain researchers. How does the Confess Project build partnerships and maintain engagement to support their work?
So a lot of them, believe it or not, are merely organic, but I like to say a lot of them very sustainable. We've partnered with Gillette for about 4 years. Believe it or not, in February of 2023, Gillette is offering us office space inside of the Gillette headquarters museum in Boston. Really excited about that. Really big move. Is going to allow us to leverage the greater Boston area, build a stronger rapport working with Harvard, and we work with Babson College, working with the Boston community. We've done quite a bit of work in Boston in the last few years because of their relationship. And so cultivating long-term relationships has been a winner for us, I like to say, simply because it has given us sustainability. So majority of our partnerships have lasted 2 or plus years. We have done multiple tours in the past. We worked with, Toyota, That was a partner of ours for a while. We was basically, driving around the country, doing tours in barbershops from San Francisco to Dallas, all over the country. And so we've built these partnerships intentionally, I think with a long-term aspiration that the work has to continue in order to see a change. And I think that's something that we've entered, and it helps with our coalition of barbers. And so some of the same companies, Andis Clippers is a really phenomenal clippers brand that makes clippers, makes the clipper, that they cut with. And so that's something that really connects with them. But they also support our barbers through tools. They support them through grooming education. So beyond, we offer mental health training, and they come in and provide grooming education and business education on how they can continue to keep their shops open and staying in continuity with being a good barber in the industry.
Okay, thank you so much, Lorenzo, for answering our questions. I think that's all of the questions that we had in the Q&A feature in the chat. Did you have any last remarks or comments to share with everyone before we go to our evaluation?
No, I'm just super excited. Again, thank you, everybody, for the opportunity. Thank you to Dr. Drews for allowing me to be a part of this today. And again, if you all are looking for any more of these lectures and or trainings or rather workshops, feel free to reach out to LorenzoPLewis.com. And any barbers or any partnership opportunities, please reach out to the confessprojectofamerica.org. Look forward to supporting you, and look forward to being a part of more of these webinars in the future.
All right. Thank you so much again, Lorenzo, for such a great presentation and for answering all of our questions. That's going to be it for our presentation for today, everyone. I think Stephanie is going to drop our SAMHSA required survey link in the chat for you all to click on. Completion of that survey will provide information to SAMHSA and assist us in planning future events like this one. Afterwards, after you fill out the survey, you will automatically be redirected to some additional questions from the Southeast MHTTC, and it's there that you will have the opportunity to download a certificate of attendance for your records if you need it. Just allow about 5 to 10 seconds for your browser to redirect you. And that is going to be it for our event today. Please visit our website to learn more. That's going to conclude everything. Thanks so much, everyone.